Miss Anderson, hi, my name is John Paul. I'm a social worker here at the hospital. And your doctor thought it would be good if we spoke for a few minutes about some of the things that came up while he was meeting with you. Is that okay?
Yeah, that's fine.
Great. I'm wondering, just in your own words, what brought you to the hospital today?
So I have been having just a little bit of problems with anxiety, and a few months ago, I was in a car accident, and I've been having some pain because of that accident.
So it sounds like the car accident is causing, some more lasting effects.
Right, yeah. So just it's been more difficult lately since the accident.
When you say it's been more difficult, what do you mean?
Just having some anxiety, like when I'm going to drive, or just having trouble managing some of the pain from the accident. I think is what's been really affecting me.
Have you spoken to a psychiatrist or a counselor or anybody else about this anxiety since then?
I have not, just
Okay.
my doctor.
Um, well, obviously, a car accident is something that's very traumatic. Have you found yourself able to drive since then?
I've been having some problems driving. It's just been a lot more difficult for me. Um,
Is it difficult because of the pain? Does it hurt to drive in some way, or is it's something else going on?
I think it's probably related to the accident, and I just get really anxious anytime I need to go drive somewhere.
Okay. Um, if it's okay with you, I'd like to ask you just a couple of questions to kind of see how this traumatic event might still be influencing you in terms of driving.
Okay.
Um, I'd like to use a tool called the Primary Care PTSD screen. So we're talking about post traumatic stress disorder. Is that okay?
Yeah, that's fine.
Okay. Um, just to give you some background, post traumatic stress disorder, you might hear that and think of World War One and like people getting shell shocked from being in the trenches. But actually, it's something that affects lots of people who have been through a traumatic experience, who have been through something that just sort of shakes you out of your normal daily routine, something that could be really difficult to deal with down the road.
Hmm.
So, if it's okay with you, would you mind if I read you the questions and just kind of work through that with you?
Yeah, that's not a problem.
Okay. So we're going to use this test just to try to figure out if this accident has had maybe a more lasting impact on your life. And as with all the communication that we have, anything that you tell me stays here, except insofar as I'll share with your doctor, um, except if you threaten to hurt yourself or someone else. And then just know that I'm required to report that.
Okay.
Okay. Um, so first, I want you to think about in your life, considering the experiences that you've had that were frightening, horrible, upsetting, and so keeping that in mind, in the past month, considering that experience, have you ever had a nightmare about it or thought about it when you did not want to?
Yes.
Okay. Have you tried hard not to think about it or went out of your way to avoid situations that reminded you of it?
Yes.
Have you ever felt just constantly on guard, watchful, easily startled? I'm sorry, I didn't catch that.
Oh, no, I haven't.
Okay. And finally, have you ever felt numb, or you can think of it as being detached from other people, from the activities that you're doing, from your surroundings?
Sometimes.
So I want to let you know that this screener considers a positive result for PTSD if a person answers yes to 3 of the 4 questions. And so sort of we're kind of at 2.5 right now, considering that you said sometimes with the last question. So I'm not a doctor. I'm not going to say, oh, well, you have PTSD, you should start taking this medication, that medication. But I do think it's something that when the doctor comes back, it's something that we might want to talk about just to see if maybe a referral to a sort of a talk therapist, or to see about a referral to a psychiatrist, just something where a professional can give you a longer evaluation and help you kind of talk through what you're feeling. Because it sounds like you're definitely, you may not have PTSD, but you're definitely at risk for some of these symptoms as a result, it sounds like, of your accident. So if that's okay, I'd like to, when we finish our conversation, I'd like to step out and just get some information about referrals for you, just based on that.
Yeah, that sounds like a good plan.
Okay. Thank you for being open to that. I know that some people hear these different disorders and they get really nervous, but I want you to know that your doctor and I mean, we're here to help. And we're hopefully going to be able to help you kind of move through what sounds like is a really stressful part of your life. So I also wanted to ask, you mentioned anxiety. Have you been having any depression lately? Any sort of negative thoughts, things that you can't stop thinking about in a negative fashion?
Well, I mean, I do think often about the accident, and it's not really necessarily negative, but just more having a hard time with driving.
I understand. Okay. So it sounds like driving is like a trigger for you for these feelings. And I guess I'm wondering, when you get in a car, whether you're driving or not, I mean, what do you think about now?
Sometimes I think about the accident that happened. I think about how it's going to be really hard for me to drive, and it's almost like my thoughts just start racing. So it's usually things like that.
It definitely sounds like you have just a much more increased level of anxiety now, and it's definitely something we want to bring to the doctor's attention. Again, referring perhaps to psychiatry and just seeing if there's some short-term things we can do to kind of lower that anxiety. And again, thank you for being so open and really being honest about how you feel, because that really helps us help you. Before we finish today, with every new patient that we have to just go through a risk assessment just to make sure that everything is going okay for you and that you're going to be safe.
Okay.
So if that's okay with you, we're going to use an assessment tool called an SBQ-R. So we're going to be talking about suicidality and just making sure that you're safe.
Okay.
And as with the other assessment, would you mind if I read it to you?
That's fine. I don't mind.
Okay. So this is going to get a little intense. These questions can be a little difficult, but as with the rest of our conversation, it'd be really helpful if you could just be honest and know that anything that you say stays here, with the caveats that we talked about before. But this isn't like, oh, I'm going to tell your friends or family what you're saying. I mean, this is for you to help you get better.
Okay, sounds good.
The first question is, have you ever thought about or attempted to kill yourself? And your options are never, that you've thought about it, just in a fleeting sense, a brief passing thought, that you've thought about it and you've had a plan at least once to kill yourself, but you didn't try to do it, that you had a plan at least once to kill yourself, and you really wanted to die. That you attempted to kill yourself, but you did not actually want to die. And finally, you attempted to kill yourself, and you really hoped to die. So which one of those sort of best fit how you feel?
I would say that I have thought about it and had a plan, but I didn't act on the plan.
Okay. So just following up on that, how often have you thought about it in the past year? Have you thought about killing yourself?
Probably a few times, like maybe 2 or 3 times.
2 or 3? Okay.
Mm-hmm.
And have you ever told someone, friend, family, loved one, suicide hotline, anyone that you were going to commit suicide or that you might do it? And your options are no, yes, once, but you didn't really want to die. Yes, once, and you really did want to die. Yes, more than once, but you did not really want to die. And yes, more than once, and you really wanted to die.
So yes, but I did not really want to die.
Would you say that would happen once or more than once?
One time.
And just in your own opinion, how likely is it that you will attempt suicide someday? Never? No chance at all? Rather unlikely? Unlikely? Likely? Rather likely? Or very likely?
Unlikely.
So I want to really commend you on, as I said, being honest, because that's really, really important. And I know that this is a difficult topic to talk about, and it sounds like you haven't really spoken about it much, maybe once before. So I really want to commend your courage for doing that. Just looking over the assessment, I want to let you know that you're definitely at risk for suicide in the future. And that doesn't say that, oh, you're going to commit suicide or that you have a problem or there's anything wrong with you necessarily, but know that suicide is not a normal response to stress.
Mm-hmm.
Suicide is something that seems like a solution, but isn't. I mean, if you think about it, suicide, these thoughts can come up when our ability to cope is sort of outweighed by the stress of the situation.
Mm-hmm.
And so one thing we can do is to increase our coping resources.
Okay.
And I know that you're just here for some pain related to your accident, and you're not here for this whole conversation. But if it's okay with you, I'd really like to refer you to someone where you can speak a little bit more deeply about this, because it sounds like there's just been a lot kind of that's been going on in the last month after the accident.
Mm-hmm.
And, there's the anxiety, there's the thoughts of suicide, and it seems like it would be a good idea if we were able to connect you with someone that could really sit down and help you work through this.
Yeah, I mean, I'm definitely open to that because I want to get to a point where I'm feeling better and my anxiety is a lot less.
Okay. No, I that makes complete sense, and that's a great desire, because ultimately this desire to get better, that's the first step to getting better. So it's awesome to hear that you want to take these steps. So if it's okay with you, I'm going to step out and I'm going to kind of just go over what we just talked about with your doctor, and he'll come back in and kind of go over a few things, and then I'll be back later with some information about some providers that we can refer you to. Okay?
All right.
And I just wanted to check in before I leave. Have you had any suicidal ideation in the last 24 hours?
I have not.
Okay. Good to know. Great. Well, I'll get that information and I will send the doctor back in.
All right.
Thank you so much, Ms. Anderson.
Mm-hmm.